Now to the race to develop a coronavirus vaccine. Pfizer made headlines yesterday saying it could have a vaccine ready for emergency use as soon as September.
Dr. Anthony Fauci has said there is a possibility a vaccine could be ready as early as January. But how realistic are those timelines? Our Dr. Frank McGeorge is here to explain why it's a real long shot. Doc?
Yeah, guys, to say it would be unprecedented to develop a vaccine that fast doesn't even begin to cover it. The current record for developing a brand new vaccine is 4 years. That said, some of the usual hurdles have been removed in this global race, and that's why some experts believe a significantly shorter timeline is possible, though not necessarily probable.
How long does it usually take to make a vaccine? The chickenpox vaccine took 28 years. Flu mist, also 28 years. The HPV vaccine was in development for 15 years, as was the rotavirus vaccine. Mumps was considered lightning fast at 4 years. So why does anyone think it's possible to do this faster? Well, first, given the global impact of COVID-19, there's been no time wasted trying to secure funding. Second, many of the vaccines are building on work that was already done in the effort to create a vaccine for SARS or MERS. SARS and this new coronavirus are about 80% identical. The Oxford team was already working on a vaccine for a different coronavirus, giving them a head start on this SARS-CoV-2. Now, some researchers, including those at Pfizer, are taking a new route, using something called messenger RNA. It's a faster method, but no such vaccines have ever been approved. Researchers are also combining phases of testing and testing multiple vaccines at the same time to narrow down the best candidate without having to start over. Another shortcut? Manufacturing. Many companies are ramping up production capability or even producing their vaccine already in hopes that it will prove safe and effective. The Gates Foundation has said it will fund the construction of factories for 7 promising coronavirus vaccines. That could mean millions of doses ready to go or nothing to show. Only time will tell.
Now, you might recall back in 2009, researchers were able to create a vaccine against the swine flu in about 5 months. Now, that was only possible because it used the same manufacturers and materials that we already used to create the seasonal flu vaccine, so they really weren't starting from scratch. And by the way, the man who led the effort to fast-track that vaccine was none other than Dr. Anthony Fauci.
We've got to ask you, Doc, there's got to be a little bit of skepticism in terms of if they go really, really fast in approving this vaccine, I assume the public is not going to trust the vaccine's safety.
Well, yeah, that is definitely some concern, but, ultimately we need a safe and effective vaccine that people are willing to get. Realistically, that isn't going to happen as fast as anyone would like, but there are, frankly, a lot of really smart people around the world doing their best to at least make it possible.
Right, and as you said, the whole world trying to find the right cure. We appreciate it. Thank you, Doc.